Depression, the disease of the 21st century. Depression is a complex medical condition that affects millions of people around the world. It is characterized by a variety of symptoms, including persistent sadness, lack of energy, sleep and appetite disturbances, difficulty concentrating, and loss of interest in activities that were once pleasurable. While depression can be debilitating and affect people's quality of life, there are many effective solutions available to help ease your symptoms. In this article, we will discuss some of these solutions. Therapy. Therapy is one of the most effective solutions to treating depression. Cognitive behavioral therapy, CBT, in particular, has been proven to be a highly effective approach to treating depression. CBT is a type of therapy that focuses on identifying and changing negative thoughts and behaviors that may contribute to depression. Therapists help patients identify negative thinking patterns and challenge them with more realistic, positive thoughts. Additionally, therapy can help people develop effective coping skills to deal with stress and anxiety, which can contribute to depression. Medicines. Antidepressants are medications that help relieve the symptoms of depression. They work by altering the levels of neurotransmitters in the brain, such as serotonin and norepinephrine. Antidepressants can take a few weeks to start working, but for many people, they are an effective solution. It is important to remember that antidepressants are not a quick fix or cure for depression, but rather a way to help alleviate symptoms while the patient works on other aspects of treatment. Physical exercise. Physical exercise can help alleviate the symptoms of depression, as it helps to release endorphins, the so-called happiness hormones. Additionally, exercise can help improve self-esteem and self-confidence, as well as provide a sense of accomplishment. Exercise can also help improve sleep, which can be particularly helpful for people suffering from depression-related sleep disorders. The recommendation is at least 30 minutes of moderate physical activity per day, such as walking, running, cycling or swimming. Healthy diet. A healthy diet can help ease the symptoms of depression. Depression can lead to changes in appetite, which can lead to unhealthy eating or a loss of appetite. It's important to try to eat a balanced, nutrient-rich diet to help keep your body and mind healthy. A healthy diet should include lots of fruits and vegetables, whole proteins, lean proteins, and healthy vitamins like those found in salmon, avocado salmon, and olive oil. Additionally, it's important to limit consumption of processed foods and refined sugars, which can lead to fluctuations in blood sugar and worsen symptoms of depression. Adequate sleep. Lack of adequate sleep can make symptoms of depression worse. It is important to try to maintain a regular sleep schedule and get at least 7 to 8 hours of sleep each night. Some tips for improving sleep include maintaining a quiet, dark bedroom environment, avoiding electronic controls before sleep, and limiting caffeine and alcohol intake. If insomnia persists, it is important to speak with a healthcare professional to discuss treatment options. Stress reduction. Stress can be a trigger for depression and can make your symptoms worse. It is important to try to reduce stress whenever possible. Some effective strategies include meditation, yoga, deep exercise, and other relaxation techniques. Also, it's important to identify the sources of stress in your life and try to find ways to manage them effectively. This can include delegating tasks, setting healthy boundaries, and learning to say no. Social support. Social support is a key part of treating depression. Having a support network can help people feel less forgiving and better cope with life's challenges. This can include friends, family, or support groups. Participating in social activities such as hobbies, clubs, or volunteering can also help improve mood and self-esteem. Emotional self-regulation techniques. Emotional self-regulation techniques can be helpful for people with depression. These techniques help people identify and regulate their emotions, which can help prevent or manage episodes of depression. Some effective techniques include mindfulness, acceptance and commitment therapy, and schema therapy. These techniques can help people develop greater emotional awareness and learn to deal with difficult emotions more effectively. Mindfulness. Mindfulness is a technique that involves paying attention to the present moment without judgment. Mindfulness can help people reduce stress and anxiety, as well as improve mood and self-esteem. Mindfulness meditation is a popular technique for practicing mindfulness, but it can also be built into other meditative activities such as walking, eating, or washing dishes. Self-care. Self-care is a set of practices that people can adopt to take care of themselves, physically and emotionally. This includes habits such as healthy eating, regular physical activity, good sleep hygiene, and relaxation techniques such as meditation or yoga. Self-care also involves setting healthy boundaries, learning to say no when necessary, and making time to do things that bring you joy and personal satisfaction. For many people, taking care of yourself may seem selfish or indulgent, but in reality, it's an important part of mental health and well-being. When we take care of ourselves, we are becoming stronger, more resilient, and more capable of facing life's challenges. Additionally, self-care can help prevent or manage mental health issues such as depression. When we take care of ourselves, we are sending a message to ourselves that we are important and worthy of care and attention. This can help improve self-esteem and reduce feelings of anxiety or stress. Some common self-care practices include: get enough sleep. Good sleep hygiene is critical to mental and physical health. It's important to try to get at least 7 to 8 hours of sleep a night, maintain a regular sleep schedule, and avoid electronics before bed. Exercise regularly. Physical activity can help improve your mood and reduce stress. Try to find an activity that you enjoy and that you can regularly incorporate into your routine. Healthy eating. A balanced, healthy diet can help reduce your risk of mental health issues such as depression. Try to include lots of fruits and vegetables, lean proteins, and whole grains in your diet, and limit your consumption of processed foods and sugars.